Hi, I'm Bob Ravenscroft, the Vice President for Advancement at Bryan LGH and the Vice President of Advancement at Bryan Health. If you recall from previous B-Tubes, we talked about the process of our board providing the approval to go ahead last spring. That triggered a series of events. Board resolutions from all of our system entity boards had to be collected, officially approved, and once that was done, it really triggered a ton of behind-the-scene action. What you're going to hear from some leaders in the organization is what they've been doing behind the scenes. You're going to hear them introduce themselves as members of the Bryan Health team because on one hand, we're already legally Bryan Health. You'll learn that. In the eyes of some other organizations, we're still Bryan LGH and can continue doing business as that for a period of time yet. So I think it's a good chance to hear from them, begin breaking the habit of Bryan LGH, introducing the Bryan Health language to it, but more than anything, understand what people are doing behind the scenes to make sure everything is done in a legally compliant manner, and most importantly, not interrupting cash flow to the organization. Because if there's cash flow interruptions to the organization, what it ultimately does is impacts what we can do to fulfill our mission. So I think you'll find we're in great hands with the people who are working diligently behind the scenes, and I'm happy to introduce them to you.
Hi, I'm Joe Loudon. I'm the Legal and Compliance Officer. I've been with the health system for going on 15 years, and after a series of board resolutions by all the various boards, and the health system board approved all those resolutions, we had to actually make the legal name changes. So I went down to the Secretary of State's office here in Lincoln, down at the Capitol, and filed legal name changes for Bryan Health, Bryan Medical Center, Brown Foundation, Bryan Physician Network, and then those legal name changes went into effect almost immediately, and so we knew by the time I left Secretary of State's office that we actually had those legal names. And so on legal documents, we're starting to use those names, but in terms of our name to the public, we're still known as Bryan LGH. We can still use that name, and we will use that name until we roll out the formal name change later this year.
Hello, my name is Julie Lacey, and I'm a Senior Accountant in Management Accounting at Bryan Health. When Joe filed the Articles of Amendment with the Nebraska Secretary of State's office, we filed the articles with the IRS the very same day, notifying the IRS of the name changes and asking for their approval of the changes. We expect to receive notification back from the IRS approving the name changes by the end of August. Once we receive written confirmation back from the IRS, we will start the process of notifying the banks, the state departments, and all the vendors, over thousands of vendors, of the name change.
Hello, my name is Jeff Burke. I'm the Corporate Director of Supply Chain with Bryan Health, and I've been here approximately 10 years. The impending name change has prompted a number of initiatives within the supply chain function. First and foremost, we've been working with the print shop to convert approximately 2,000 forms, and those are all targeted to be completed within the month of October. Another item that we're working on, which you'll see throughout the community, is vehicles. The vehicles that we use within our fleet will be retitled and have new registrations, and also decals on all of them changing to the Bryan Health logo. And you will see those starting after Labor Day. Two other initiatives which are equally important are the post office. We mail out tremendous numbers of documents, and we have to have a legal change with the post office in effect for October. And last but not least are all the vendors. We deal with thousands of vendors throughout the organization, and we also have to legally change our name with them within the month of October as well.
Hi, my name is Arlen Rasmussen. I'm the Director of Patient Financial Services here at Bryan Health. As Julie had mentioned earlier, we filed some paperwork with the IRS to assure our tax-exempt notification with the name change. Once we receive that back, we have another initiative that has to happen. That will be notifying Medicare, which is CMS, and all of our managed care payers of the name change and get their approval. Without Medicare's approval, we cannot continue billing, and as Bob mentioned earlier, the cash flow is going to be a huge issue.
I hope you enjoyed hearing from Joe and Julie, Arlen, Jeff. Their teams and many others are working very, very hard behind the scene to make sure everything is done in the appropriate manner. So on one hand, we are legally now Bryan Health. we're still doing business legally as Bryan LGH and can for some time. But rest assured, we're in great hands, and if you have any questions about some of the technicalities that are going on, feel free to contact any of those folks or myself to learn more. So you now know the drill, and if you want to enter the trivia contest for this week, stay tuned to the slide that'll come up on the screen to reveal this week's question. Thanks.